One of the most common questions I get at the office is, Doctor, what if you just remove all my teeth and give me dentures? I know it sounds very easy, and sometimes patients say, well, just take everything out. I'll be more comfortable, I won't have infections, I won't have any pain. However, not having teeth represents a great challenge for the patient. In this video, I want to show you what options we have left when we no longer have teeth, and how you can continue to smile and eat. Before we continue, I'd like to recommend that you subscribe to my channel and click the bell so you can keep watching videos like this one. Now, let's get to the topic. The most common option, and the one that has been working for a much longer time, is dentures. Dentures are prostheses made of a card. These are complete and they fully cover the upper and lower jaw. Now, for many patients, it's very convenient because they no longer have to worry about cleaning their teeth. It's much simpler. You have to clean the denture, of course, but the challenge is much smaller. Any patient who doesn't have teeth can use a full denture. Of course, there are limitations. If the patient doesn't have enough bone or has a very thin bone ridge, it will be very easy for these dentures to become dislodged. Therefore, they will have to use an adhesive. If these dentures are made by an expert, they can turn out very well. They can look aesthetically perfect. And the advantage is that the patient can pretty much choose the tooth they want, the color they want. You can have crooked teeth, beautiful teeth. It's very flexible. Of course, you have to take facial proportions into consideration so you don't end up with teeth that don't match the patient's face. Now, if you're worried about the prosthesis becoming dislodged and you prefer something that isn't removable, then dental implants exist. What are the advantages of this? Of course, dental implants will allow the prosthesis to be screwed into the bone. What does that mean? It means you will no longer have to take the denture in and out. 4 or 6 implants can be placed, and an entire bar will be supported by those implants, just like in the case we see here, where we placed 6 implants for the patient, and a bar of teeth was screwed into her bone. It looks spectacular, and as you can also see, the natural look of the case is amazing. Now, the disadvantage of this is definitely that not all patients can get implants. There are certain requirements for getting implants. You can see that in the video I'm linking above about dental implants, and also the cost. The cost is definitely completely different. I can practically tell you that an implant-supported denture costs 10 times more than a conventional denture. But if you have the financial means and the physiological and anatomical possibility of getting them, it's much better because it's not removable and it's much more comfortable. By not having a plastic palate, food tastes much better, and you can also speak better. Now, there are intermediate cases. For example, let's suppose you don't want or can't get 6 implants, but you get 2. There are dentures that have an attachment called a ball and socket, or ball attachments, which consist of the following. The denture will go over the gum just like the others. The difference is that there are 2 implant abutments supporting a ball attachment, and the denture has the female part of that attachment. So when it snaps into place in the mouth, it creates suction and grips it. Definitely, it can be taken out and put back in, and it can be cleaned. It's not as effective as a fixed one, but it's quite good and works well, especially in the case of the lower jaw. For the upper jaw, I would prefer not to place any implants at all rather than placing just 2. The success rate is not as good in that case. So to summarize, we have 3 options for when patients have no teeth. The first and most common is a complete denture. This one covers the entire palate or the lower part of the gum. It can be placed in practically any patient, and the limitations, obviously, are that they come loose very easily and can be uncomfortable when chewing if the patient doesn't have perfect bone structure. What does that mean? That some patients have so little bone that the nerves are very close. So when you bite down, it hurts. Well, that can be a negative. Now, another negative definitely is phonetics. Patients sometimes can't speak well and have to get used to speaking. And something very important, no denture is going to fit perfectly the first time. You always have to be getting used to it. The muscles have to get used to being able to hold a denture, and obviously it will take time. The second option is dental implants. They are very practical, very aesthetic. However, the cost is 10 times more than a normal denture. And you have the third option, which is to place just 2 implants with a ball attachment, where the denture is retained by suction on these 2 implants. The advantages it has is that it's a little more retentive than a prosthesis that doesn't have this. Disadvantages are that implants can't be placed in all cases, and I don't recommend it for the upper jaw. It's very important to be clear that if you have your teeth, don't have them removed, unless they are really very loose and causing you a lot of problems. Go to a good dentist who can give you a good diagnosis, and preferably keep your teeth in your mouth. Now, if they are infected, cause you a lot of problems, or you have a health issue that doesn't allow you to keep the teeth in your mouth, then first get informed, like with these videos, about what can be done before losing all your teeth. So remember to subscribe to the channel so you can keep watching videos like these every time I upload them. Click the little bell, give it a big like if you enjoyed this video, share it with someone you think might find this information useful, and I'll see you in the next video. Take care.